Hi, Stacy.
Hi.
How are you doing today?
I'm good. How are you?
I am well, thank you. I heard you were recently diagnosed with psoriasis.
Yes.
How are you feeling?
Good. A little itchy.
A little itchy? Okay, that's normal. Do you know anything about psoriasis?
I don't.
Okay, so it's an inflammatory skin condition. It causes rashes. These rashes are usually dry, itchy, scaly. It's what sounds like what you're experiencing on
Yes.
your arms and your legs.
Correct.
So there are different types of psoriasis, different forms of the disease, and you have what's called plaque psoriasis. And plaque psoriasis is actually the most common form of the disease, and it's usually red, scaly, thick patches on the skin, most commonly on the arms and the legs, and usually is worse on the knees and the elbows. So these rashes have like a silvery coating on them. They're usually very dry, and like you said, they can be very itchy. So although the exact cause of psoriasis is unknown, it's actually thought to be a result of the body's own immune system. It's kind of attacking your own skin. Genetics have also been shown to have a role in psoriasis. Do you have any family members that have that condition?
I do.
You do? Okay, well that could be definitely passed down to you, so whatever family member, you can blame them. Different environmental factors, they can also take a play in it, just your skin's overall condition. If your skin's dry, you're more likely to exhibit the symptoms, especially in the winter months when the skin tends to be more dry. The symptoms might flare up. So with psoriasis, it is a chronic condition. It's lifelong. You will have periods of relapses and remissions, which means a relapse will be a flare-up of the symptoms. You'll all of a sudden develop these rashes. It could overnight, you'll wake up and you'll have some rashes. They can be treated. There's different treatment options. And then you can go into remission where you could go months, even years without any sign or symptoms of the disease. It could be completely clear. So a flare-up of psoriasis can be caused by internal or external factors. Stress is a big known cause for flare-ups. So if you're having just a stressful day, a stressful experience in your life, you might come to notice that you'll have a flare-up of your symptoms. And like we talked about, the different environmental factors, just your skin's overall condition, the dryness of it. That's why, as far as treatment options, the easiest and most important treatment that you can do for psoriasis is just keeping the skin clean, having good skin hygiene, and moisturization. You want to keep your skin very moisturized at all times, because that excessive dryness of the skin will cause flare-ups of the symptoms and make your symptoms worse.
Okay.
So as far as keeping the skin moisturized, you can use any good over-the-counter lotion. They do make over-the-counter creams and ointments specifically made for psoriasis. And also, for other treatment options, there are prescription creams and ointments that we can prescribe to you. They usually have a steroid in them. Those are usually more effective for worsening symptoms. So if we try the over-the-counter treatments, they're not working for you, we can prescribe you one of these ointments that have a steroid in them. That might help clear it up.
Okay.
Other treatments, if the ointments or the creams don't work for you, there are oral medications that we can give you. We can try antibiotics. So there's some common antibiotics that we give for psoriasis. There's also medications called biologic or systemic medications, which they actually suppress your body's own immune system. Since your body is fighting against itself and causing these psoriasis symptoms, these medications suppress your immune system to help your symptoms actually fade away. If those oral medications don't work, there's actually injectable medications, kind of the same type of action. They're immune suppressants. They will suppress your immune system, but usually the injectables are a little bit stronger. So there's one common one that's called Humira. You've probably seen commercials on Humira. That's one that we prescribe pretty often. And lastly, usually the last line of treatment, if all of the rest that we just discussed don't work, is called ultraviolet light therapy. So it's a UV light that we use in the office, and basically what that UV light does is it slows down the regrowth of skin cells So it gives your body time to heal the affected areas rather than producing more skin cells in those flare-up areas that make it worse. So those are just the different types of treatment options. We're obviously going to start with some basics. We're going to prescribe you an ointment to use with some steroids in it, try to clear that up, and then we'll go from there. Other than that, do you have any questions?
I don't.
Okay, so I'm going to give you some educational material on psoriasis, just so you become a little bit more familiar, and it's just a little pamphlet. If you have any questions or concerns and you want to know a little more, feel free to reach out to us.
Thank you very much.
Thank you. Have a great day.
You too.
Thank you.